My name is Dirk Laubscher, and I've been a physiotherapist for over the last 10 years, working in Harley Street for the last 6. And today I'm going to talk to you guys about the causes and the management of back pain. How to find hip pain relief. It's important when it comes to the hip that we make sure that we find out where the pain is coming from actually, because hip pain can actually just be a referred pain from your back, and if that is the case, then it doesn't matter how much you treat the hip. You can treat it till you're blue in the face, you will not get rid of that hip pain. So again, with a good therapist, they would do tests to basically differentiate between if it's coming from the hip or if it's actually being referred from the back. Because we're talking about back pain, a lot of patients I see suffers with hip pain as well. And what it is actually is it's a referred pain from your back. In my experience, one of your hip muscles called Gluteus Medius, which is a stabilizer of your pelvis. What it means is when you walk and you put weight on, the muscles on both sides contract to keep your pelvis level. Now, when some of them are weak because of, let's say there's back pain and these muscles shut down, you get an instability when you walk, and again that will cause muscles to tighten up, to form trigger points, and they will basically be like little golf balls, or maybe like cricket balls on the side of your spine. Not your spine, your hips. Okay, so the way I treat hip pain when it's referred from the back is by mobilizing the lumbar spine. Firstly, we have to loosen up the lower back, make sure that all those joints on the bottom of your back are nice and loose, like the muscles are released, they're nice and soft and juicy. And then also what I do is we work down the hips into the muscles. We call it trigger point massage, where we apply pressure on the tight areas, and mostly that pain that's reproduced when we push on that tight area is actually the pain the patient experiences in his hip. Okay, so again, by putting pressure on it, we can release that tension. I also use dry needling, which is a technique that we basically use acupuncture needles. It's not acupuncture, but we go locally into the actual trigger point where we want the trigger point to release its tightness. And we're also increasing blood flow in that area. Okay, another thing how we treat hip pain is by strengthening actually your hip muscles. All right, again, those muscles that have been tight and weak, Gluteus Medius most of the time, that stabilizes your pelvis when you walk, we have to get them strong. Otherwise, again, you will only have short-term pain relief. All right. Another cause of hip pain could be, or it's actually called Piriformis Syndrome. Now, piriformis is a little triangular muscle that sits sort of right in the butt, in the middle of the butt. It's a quite deep muscle, but what happens with them is the actual sciatic nerve, the big nerve that comes out of the back of your back, runs through it. And sometimes when that piriformis muscle tightens up, it can cause pressure on that nerve. And again, you can either refer pain to your leg or actually refer pain into your hip. Okay, so by treating the piriformis muscle, that's basically how we get rid of that hip pain. A very good hint is to take a tennis ball and you put it on the side, you go and lie on the floor and you put it on the side of actually underneath you, and you roll on the tennis ball until you get it onto that tight area, and then you sort of just hold it there and you push it down. Okay, if you're a bit more adventurous and a bit more adventurous, you can use a golf ball. But again, a golf ball is very hard, but it really goes very deep, and it can help you a lot with those trigger points. Another cause of hip pain can be your sacroiliac joint, which is basically this joint here. Okay, it's where your spine, basically your sacrum connects to your hip bones. Okay, and again that joint again can refer pain into your hips as well. Right, and to treat that, usually you need, again, a therapist to, what I found work really well for that is muscle energy techniques. Is where you use the actual tendons and the muscles of the pelvis by doing a contraction of it to actually line the pelvis and to line the sacroiliac joint completely. All right, so just to recap, hip pain can either be coming from the hip, from the actual ball and socket joint, okay, or it can be referred from the back. Again, there's differentiation tests that you can do to make sure that it's either coming from the back or from the hip. Obviously, when it's coming from the hip, it's other treatments you can do for that. But if it's coming from your back, physiotherapy is very helpful to get rid of those tight muscles, to actually align your pelvis, and also to strengthen your core and your hips.